We are gathered here to celebrate this great institutional milestone, which serves as a reminder that great things happen when people come together for a common cause.
It's a privilege to stand here today, not just unveiling buildings, but celebrating true collaboration, faith in action, and the power of community.
The USAID Asha project is an infrastructural project that we've done in the hospital and the college part of the hospital. And the project began in February 2023 and has covered several infrastructural components in it. So a road that's about half a kilometer going from the main road to the school, the College of Health Sciences. There is 3-floor, 6-unit housing for our staff. That's, and then we have a perimeter wall and gates here, and some classrooms. That includes not just classrooms, but library and some admin offices.
It's the new infrastructure that you've just helped the college to have. It's a great one because number one, it creates a very, very unique environment because the mentality at learning is very important. Some students will compare themselves with the universities that are well built, but when they come, they just have a different mentality when they see the kind of infrastructure that we have now, and the learning environment will be very different. There will be no squeezing in the classrooms. There is enough room for every bit of good learning.
The accessibility of the library, I can see this one is bigger, bookshelves where you can there is even a space that someone can sit and even the skills lab look bigger to access, like rather than the ones which were down there, because we need the skills lab in practicing our skills before we go to the clinical practices. Our morale, at least we are even proud of this school.
Because the vision come true, and it gives a lot of fulfillment and satisfaction that we've added value. This was just a dream, now it's a reality, and we are seeing, they could even wait, the students are already there. So it's a sense of accomplishment, but we feel a lot of gratitude.
Before, like when this hospital was being built, you can be able to see that this hospital was built. The last innovation was in 1971, when we have got these other new buildings. But since then, you can be able to see that's about over 50 years ago. So now our intake, we are able to do the intake, and you can be able to see that with the assistance now, you see like the college is having now about 500 students. Before then, it was having about, I think it was having less than 200.
Having modern classrooms and having comfort for our students has improved our outlook and basically how we are viewed by the community and the people who seek to bring their children for training here at Chogoria.
The impact is that what I've seen is that we have even the intakes being done 2 years ahead of time. Like now they are doing the intake for 2027, which I think has been necessitated by the expansion of the classrooms. I also think now that the staff have houses, things should also change, that the timeliness, you can extend the classroom because the teachers are within the compound. So the impact will be bigger than maybe what people thought.
They feel more at home now because they feel more secure committing to the course here. The residential houses are comfortable houses. They are basically good sized, good amenities. They are comfortable. And so I would say the fact that some of our staff don't have to live outside and they can live here. Obviously, it's a big motivation.
In every institution, you find that the majority of students are local students. And so when we have a good facility that has got good facilities, then it means more students from the area will come in. More students will come in. When more students come in, definitely we are creating business for the business people around. Even for me as a farmer around, I have somewhere to sell my milk and my sukuma wiki. Yeah, because we are attracting a bigger community to live around.
We really appreciate the role that MBF came in as a core funder. The impact it had on my workers was immense. Some of them gave their lives to Jesus. So I think working in a Christian-based institution like Chogoria impacts more not only on us, maybe over and above the communities within Chogoria.
In Kenya, the faith-based organizations and private sector contribute around 40%. In fact, I was calculating in our county, I realized that the county government provides around 56% of health service, and then the faith-based and the private sector provides around that 4%. And then PCEA Chogoria is the biggest faith-based organization or institution because it has the training of the basic health courses, because they do not train nursing, they train other courses within Irvine. And we also have the training of our doctors at master's level in various courses, and many of our doctors are actually the beneficiaries.
Mine is to come and congratulate and say thank you even to the team from MBF through the USAID that has enabled these projects to go to completion. And as a government, we continue to recognize the vital role that faith-based hospitals continue to play in providing accessible and affordable healthcare. Just know that you remain key partners in strengthening the primary healthcare in the country and advancing universal healthcare.
Must say thanks again to the Kenyan government, the exemption from the VAT, that percentage on that much money and what it built. Oh my gosh. The cherry and the on the ice cream sundae. It just was brought so much more, including what you saw at the gates.
That is what we are celebrating today, that you have done well. MBF, you have done us proud. You've caused us to feel honored and to feel like we have fulfilled our duty, our calling, our responsibility. Thank you for being so good collaborators.
As Psalm 127:1 reminds us, unless the Lord builds the house, the builders labor in vain. Today these efforts are returned to the Lord, recognizing his hand in every brick, every plan, and every life touched here.
There's a lot of bricks and mortars, but this, of course, is about the future. Getting more nurses equipped to serve here in the local region, Chogoria, in Kenya, throughout the world, perhaps. And that compassionate care is going to, of course, represent Christ.
To our well-wishers, I would tell them that may God bless them, because it is such a great sacrifice to us students, because it is not only building the capacity, but building a room for graduates, not only us, but the ones who will come after us. And they are making our dreams to be valid. And we appreciate so much about everything that they are doing to us, and we must make them proud.